Today I'm filming from L'Oréal headquarters in Paris, and I'm sharing a very rare glimpse into the minds of two exceptional skincare scientists. Dr. Patricia Brieva, PhD, is Vice President Global Medical for SkinCeuticals. She spent 13 years in R&I and worked in formulations for SkinCeuticals, CeraVe, and La Roche-Posay. Dr. Stephen Lynch, PhD, is the head of skincare scientific valorization at L'Oréal USA. He oversees product development, clinical testing, and ingredient strategy for brands including SkinCeuticals, CeraVe, and La Roche-Posay. I've had the privilege of working with each of them for many years now, and after every project we've worked on together, I feel both inspired and informed on a completely different level. And we'd really appreciate if you like this episode to please like, subscribe, and leave a review, and share with someone you love. Patty and Steve, thank you so much for joining me on AgeLess here in Paris at L'Oréal headquarters. Steve, I'm going to start with you. Brands and products that claim very short-term changes in the skin, short-term improvement in the skin. What would you say to any of the listeners who maybe are very attracted by those claims, Steve, versus actual skin longevity, impact on long-term skin health?
So I think there is some value, of course, to short-term changes, right? For sure. Everyone likes to put on a product and have an effect, right? But I think we just have to certainly separate that from meaningful physiological changes in the skin, which we know scientifically, these things take time. It takes time to remodel your matrix proteins or stimulate your gags, or like all of the things that we know are like really important for skin. And so we need to have patience. And we try and design our formulas, of course, to do that. We find that it can help to have some more short-term benefits along the way, but these can't be the only benefits, and they really can't be, the main point of the products. Otherwise, immediate benefits, it's more like makeup than skincare.
Yeah, oh, nice point. How long can some of these biological changes take to actually change within the skin? You mentioned gags, etc., different aspects of the extracellular matrix. How long can they take to show up biologically?
I think, we start seeing these things maybe after a month, really more like 3 months. 6 months is probably better, right? They are slow, and we have studies that show like you're still seeing increase over time.
It's also really interesting from a clinician perspective, because obviously, as part of your studies, you also include PRO, so patient-reported outcome, capture data, and it's something that I do a lot within my clinic, because I think it is useful. And again, in some of the testing that I've done with yourselves, some patients and subjects will report 7 days my skin felt smoother. In 7 days, my skin felt brighter, whatever. So I think it is helpful to utilize that, but also where I think there's a power in this point is that when we're integrating it within clinical practice with treatments, so you've proven in the lab and, ex vivo, et cetera, and then within clinical trials that it may take 4 weeks, perhaps 12 weeks to actually implement biological change. But when we integrate it with energy-based devices, lasers, microneedling, even some of the injectables that we've been doing, actually it can really increase not just the speed, but the power of both the topical and the procedure itself.
And quite difficult, because I would say to see a product do something on monotherapy is hard enough. And then now you're putting it on top of a procedure, which is efficacious. This is why you're paying hundreds of thousands of dollars. And now you have to show the added benefit of these products. And this is why we really like when we have the placebo cell and we're able to show that, a regular placebo with the post-procedure is just going to show you this. A product that has high levels of actives is going to show you that augmented downtime, overall appearance, that consumers also appreciate post-procedure or pre-procedure as well. We've also been noticing
Definitely, that skin prep.
that.
I think with the increased trend of facelift, like re-emerging, it's been very interesting how there's a number of surgeons who aren't necessarily advocating for their patients to prep the skin, like 4-6 weeks ahead or even multiple skin cycles ahead. But then the patients who do that for multiple skin cycles, I mean, it's completely incomparable, the results, plus minus a laser, on the day of surgery. You're probably hearing that from your other clinicians as well.
It's so important. I can't agree more.
You just triggered a thought in me. When we are designing studies, real world studies, and obviously in clinical trials, how reliable are split face studies when you're testing one half of the face with one product versus placebo or control? How reliable are they, Patty?
Such a fun question to ask. Ask me because I'm always going back and forth, and it actually depends. And in some designs, we've done the split face. Some places we've done full face for a couple of reasons. So if we are doing a study where we would say that the serum placebo and the serum technology is apples to apples, texture is the same.
Okay.
I think migration could be minimalistic, so we'll do the split face. Again, it's all about the patients and having that statistical power and making sure they adhere. And I'll have CROs who are very honest and say, in this season, I don't think they're going to adhere to this placebo. Their skin is going to get too dry and they're going to need another topical. Then I now mitigated some of the statistical power, and I have to have a realistic conversation that in this particular case, maybe we go to full face and we have to design. So these are the kind of elements you're asking yourself. Are the patients going to adhere? Is the technology polarizing enough? Is the seasonality going to be impacted? Timing is huge. If the recruiting of this cohort is going to take me 6 to 7 months, and I started, even if I randomize, now I'm going into a different seasonality, I'm going to be in trouble from a statistical power. So then we'll do the split face. And we really want to make sure the placebos, the controls, all these elements are also looked at. So I would say I've done studies with both. Recruiting, seasonality, adherence, technologies, making sure they're apple to apples is what we're looking at. Also regimens too, if it's 2 products versus 1 product. Can the patient actually decipher that that's the placebo? Because if there's a complete change, then they're going to know. I mean, and that's takes the bias off.
Again, you've just triggered more thoughts in me. You go from ingredients all the way to formulation and final products of so many different topicals within the work that you do. Is there a ceiling as to how many can be layered onto each other to actually still show efficacy, not cancel each other out?
It's a great question. And I think there's a ceiling, right? Because we really take pride in high efficacious concentrations. And at one point, you need that water to solubilize the oil, the base. And, if we're starting to see that the formulation texture is going to change, or we're going to ask ourselves, do we really need that active? Because the consumer is using another product, a topical, and if they're getting that active from that one, is it really necessary? You're changing the bioavailability. That's something we spend a lot of time on. So absolutely, yes, there's a ceiling. Secondary is also understanding what is in your formula and education. Because the more ingredients you add, the more you have to explain each ingredient.
Yes.
And
Very much so.
And at one point, I think you get to a point that to explain 10 ingredients versus 5 ingredients can change. If you're also speaking to an ingredient that is at a 0.001% versus one that's 1 or 2%, which we really strive to give. So I would say, yes, there is a ceiling.
It's an important question in clinical practice because, I'm always dealing with different trend cycles. So there might be patients who are really wanting to stack a lot of products, but it might not be appropriate for their skin type. But then there'll be others where I can see so clearly that they will benefit from perhaps a few different correct
Layering.
serums. And again, not just seasonally, but perhaps throughout the week, there may be the different ways where we can incorporate these different actives, and they're getting even better results. So exactly as you said, I go back to the education piece as to what each formulation is actually doing, the impact it's having, and the individual impact of each one of those products.
I totally agree. I mean, if we do it thoughtfully, right, and in a very complementary manner, I mean, this is what we strive for, right?
Nice.
And then we see the benefits.
That's good to know, that from lab all the way through to
And I love the
patient.
idea that you know who your what your patient will do.
Yes.
Yeah.
We have doctors telling us, this male will only use 2 products.
Yeah.
So I have to pick the 2 products.
Yes.
Very common. I'm very, very honest with my patients. Like, it's like upfront. There's no point them coming in and saying, "Oh no, and I'm going to do all of this." It's like, no, just tell me exactly, how you want to concord with this, and then let's tailor it to that. So we've got to be practical about that. So I know I've kind of already sort of touched on this, but Patty, when it comes to these fast trends and the trend cycles that come and go, how do you combat it? Kind of stepping from both ingredients, formulation, and directly working with doctors.
And it's one of my favorite things. And either it's talking to doctors, seeing social trends, understanding new consumer behaviors. The first thing we do is understand it. Why are they doing it? What is out there? What's the state of the art? And then the second step is, do we already have something in our arsenal that can do that? It's just that it hasn't been tested in that space, or we haven't investigated it. And if we don't, okay, let's open this journey and see what we can develop that is not going to copy something out there, but it's going to be the gold standard. And it's going to maybe solve a pathway that no one saw before to further improve the results.
It's a big goal.
And you have to be global, right? So I have to make sure that all of our markets are with the same intention, or a majority.
I mean, I think for us and for a lot of our brands, like for sure, we have to be sure, is this trend real? And is it scientific, right? I mean, is what's behind this trend, right? Dig a little bit deeper. And it's where, we'll be asked by our colleagues on the marketing side, can we have a technical analysis of these ingredients, this kind of formula? And those are fun exercises, right, to kind of dig into that, to try and really be as well educated as possible, like Patty said.
Steve, how do you decide if a trend is real?
So I guess maybe let me specify. Like, the trend can be real, but the people who are playing in the trend, are their products real? Maybe that's what I mean.
I see.
Right.
I see. And that's when you go back to the science and you test.
I think
the
so.
Concept.
Yes. So I think that there could be emerging scientific territories or trends, but different people can play on those in different ways. And we just always want to be sure that we're approaching that as scientifically and as authentic as possible.
So for consumer responsibility.
Yes.
Yeah. Beautiful. We've already discussed how people are living longer. What do you think some of the critical scientific innovations will be in order to achieve true skin longevity that keeps pace with an increasing, not only longevity, but health span in populations?
Yeah, that's a huge question, right? Certainly longevity is a very big topic, and it's a really important topic, right? So I think when I'm thinking about longevity, I think we're trying to look a little bit deeper about, some of the underlying processes behind aging. And I think as the population's living longer, right, we're shifting our eyes to prevention, right? I think, we're maybe starting to use different products in some earlier years, maybe products that, maybe are starting to address some underlying root causes of aging, things like this. So I think there's some very interesting emerging science, some interesting insights. It is where there's a lot of trends in trying to decipher, you know, which, again, coming back, which are the real trends here? Yes.
You just lead on perfectly to a question that I really want to ask both of you. So a lot of skincare brands are targeting very young children who are under 16 and many are under 10. Two questions. What do you think children need for their skin? Of course, it's different, maybe around puberty, etc. But and how do you consciously and responsibly combat that? And do you have any advice for parents?
Yeah, I think, and I've been lucky to go to a couple of conferences where they share some publications that came out, some numbers, and some consensus. And I think, although I'm not a medical doctor, I agree. A child does not need retinol. You know, does it need a high level of acids? Absolutely not. It probably needs hydration. They need SPF UV protection, because back to the preventative longevity, you know, you need your UV, you want to combat with some antioxidants, a very good cleanser, hydration, you know, and I think that's the basics at that age. And I think that is really the core of what you need at that age. And again, if your child's going through puberty, you have acne, of course, some oil combating ingredients for your sebum, for my son, some salicylic acid, but I think that's what you need at that age. And I think from an ethical perspective, one of the reasons I'm super proud of working at L'Oréal, not only from the positioning of our products, like we're very focused on how we position our products, who's the audience, and parents absolutely will have all that information and can make the decision on some of our brands. But also we look at it secondary, and I'm a little off topic, on sustainability.
Yes.
And making sure that the products that we develop will also be good for the environment that our children are also living in.
It's another important part of longevity is, of course, the environmental sustainability piece. Steve, what about you? What are your thoughts?
So I in general agree with what Patty says, right? And I think, honestly, the most powerful longevity ingredient are probably sun filters, right? And the use of sunscreen, we can prevent a lot, you know, with this. I think it's a little bit about like teaching good habits, right, to these children, right? So moisturizing, cleansing, protecting your skin. I don't think, you know, I think, of course, where we draw the line are corrective products, things like this. I mean, there's just really, it's not necessary. You know, a lot of children have very nice skin, right?
So it's a very balanced view that you take on this about helping with skin health, good habits, good information and education to the children, but not using what isn't necessary. What age would you say a child needs to start using even those good habits?
It's a harder question for Steve and I. He has two boys, I have two boys.
Okay.
So I do think I have friends who have young daughters who are already having the conversation with their 9-year-old. So I think for me, to have my 9-year-old even brush his teeth is a struggle. So, and even to have my 16-year-old now washing his face, I would say around 16. 14 to 16 is a good target. Wash your face, use moisturizer. They're actually, as children, they know very well the SPF and UV just because we know all that data and we've seen what it can do on skin. And they are very good habits in terms of UV and SPF, I would say, at an early age. We install that.
Very interesting. And finally, I just want to ask you, considering all of the topics we've just talked about, and we've covered quite a lot of ground, what are both of your two biggest skin tips when thinking about the needs of consumers and education and all the skincare noise that's out there? What is really helpful for consumers listening to know?
So I think for me, it comes back to being very thoughtful about the skincare products you use, right? I'm just reflecting on the conversation we had a moment ago about like maybe some people use too many products, right? So Be thoughtful, select products that could be complementary, and maybe, keep it relatively simple and targeted for what your skin needs.
And how do they find that? How do they find those products?
Well, I think they're consulting with their dermatologists, of course, or they're consulting reliable sources.
Okay. Okay. And you, Patty?
Oh, so for me, it's funny because if you asked me 17 or 18 years ago before I started L'Oréal, there's habits I never did. I never looked behind a carton and looked at the ingredient list. Now, that's step one. The first day I started working at L'Oréal, you turn it around. And if I'm buying an ingredient, I want to make sure it's on the top of the ingredient list. So for me, non-negotiable is an antioxidant. I stand by using it every day. High levels of vitamin C, ascorbic acid for me are my must-haves. And I just really recommend you looking at the FIL and seeing the types of ingredients that are in it, where is it placed in the FIL, and then also it needs to prove that it's doing what you're buying it for.
Thank you so much. So many pearls, so insightful. Thank you so much for joining me today on AgeLess.
It's a pleasure. Thank you.
Thank you.
I feel incredibly lucky to work with two of the most brilliant minds. And so what I want to leave you with is give your skincare time. One of the most important things to understand is that meaningful biological change in the skin doesn't happen overnight. When using a formulation that's evidence-led and you're consistent with it, repeated applications compound quietly over time. Barrier support, inflammation control, and increased cellular communication can take weeks, not days. When we expect instant results, we often abandon products just as the biology is beginning to improve. So stick with it. If you found this conversation valuable, please subscribe, share it with someone you care about, and let us know in the comments the questions that you want answered in future episodes. As a thank you for being here, you can redeem an exclusive 15% discount off SkinCeuticals products from my clinic online. Follow the link in the show notes and enter the code SkinC15 for 15% off. Together, we're redefining how we age, look, live, and feel. I'm Dr. Jonquille Chantrey, and this has been AgeLess.